Hi, everyone. Welcome to the ARC's Introduction to the National Center on Criminal Justice and Disability webinar. We're thrilled to have each of you joining us, and for those of you that invited your friends, thank you. My name is Catherine Walker. I'm the Criminal Justice Fellow at NCCJD, and I'll serve as the facilitator today. Before we begin our presentation, I'd like to go over a few housekeeping rules, especially for everyone here who's new to WebEx. Because there are so many of you, all participants are currently in listen-only mode. There will be opportunities to ask questions throughout the presentation. However, at any time during the presentation, if you need assistance, you can post a question in the chat box on the side of your screen, and I'll try and answer your questions. At the end of the session, there will be a time specifically for questions, which you can either post to the chat box or raise your hand using the icon at the bottom of the participants window, and we'll try and call on some people and get some live question answer going on. You can also email your questions to nccjdinfo@thearc.org, and we'll post that email address at the end of the webinar. This webinar is being recorded and will be posted on our website as soon as it launches in February, and we'll send you an email letting you know when the recording is available. During the presentation, you'll be asked to answer a few questions via polls, and you'll see those when they come up. The webinar today is the first of a series of monthly webinars sponsored by NCCJD and features Leanne Davis, our Program Manager for Justice Initiatives here at the ARC of the United States. We have one final request before we begin. You're going to receive a session evaluation immediately following the webinar. Please take 5 minutes to complete and submit this to us. This webinar is supported with funding from the United States Department of Justice, and it's very important for both the ARC and DOJ to have a good understanding of what you learned and how you plan to use this information. Thank you all for your attendance, and please welcome Leanne Davis. Leanne, can you make sure you're unmuted?
There we go. Now can you hear me? All right.
Yes.
I'll say that again. I want to welcome everyone to our first kickoff webinar for the National Center on Criminal Justice and Disability. And just to let you know a little bit about our staff here at the center. As Catherine said, my name is Leanne Davis, and I've been working with the ARC for almost 20 years with a focus on criminal justice issues. This has been a passion of mine for a long time, so we are so excited to get this funding through the Department of Justice to really look more closely at these issues and start working with national partners to address them. And Catherine introduced herself as our Criminal Justice Fellow. She is new to the ARC, and we are so excited to have her. We also have Amberly Romo, who is helping us create our website, and Kristen McTiernan working with communications, and we're excited to welcome Jessica Michelo as well as our program intern. And just up front, I wanted to bring out a personal story of why criminal justice issues matter so much to the ARC and to many of you who have joined this call today. James is an advisor for our National Center, and he's also a personal friend. He's encountered the criminal justice system both as a suspect and as a victim, but much more so as a victim. He really puts a story to the face of these issues that we'll be talking about today. And his story is really not that different from other people in the criminal justice system who find themselves on both sides of this issue, both a victim and also a suspect. And so it's important when you're working in the field within the criminal justice system to really keep in mind where folks with disabilities have come from and why they may have certain ideas or fears about engaging with people that are in the law enforcement area or within the court system as well. One of James's first direct encounters with police was in a bar when an officer had suspected he was drunk due to his disability. So he was with coworkers that night. It was actually at one of the ARC's national conventions. And while the coworkers had gone to a restroom break, he was alone, and an officer had come up to him and asked him if he had been drinking. And he tried to explain that he had not, but that because of his disability, his speech is slurred and some other things that made the officer think he had been drinking. And luckily, the coworkers had come back just in time, because otherwise he was being taken outside, and it just made him feel very uncomfortable. And he felt as if, he hadn't been heard by the officer or validated that he had had these particular disabilities. So on the flip side of that, James has also been a victim of crime, and in fact, multiple times. He has faced several victimizations, and it's actually taken him years to talk about it. Because we are friends and we've trained on this issue together, I feel comfortable and do have permission to share his story. But he has been involved with self-advocacy issues for a number of years, and he is used to speaking out on issues that matter to him. He's been a very effective advocate nationally, and yet when it came to this issue of victimization, it has taken him quite a while to get to the point to talk more openly about it. And I just want to direct you to the Self-Advocacy Online website, where just in the last couple of days, James has posted his story about the victimization that he has encountered, and just is really a courageous man who is willing to break open the silence around the issue of victimization against people with disabilities. So that is why this issue matters so much. And another reason is that even before we got the funding for this project, we've been getting calls from around the country from people that want to help, or they don't have the resources they need. Perhaps they want to reach out to their law enforcement, but they don't have the right brochures, curricula, the materials that are needed to really do this in an effective way. And so because of that, we want to provide that in a way that is targeted to specific audiences, and we'll talk a little bit more about that later. Also, what's important to note about this field in particular is that there really isn't that national unified voice on this topic that connects these different groups of advocates and self-advocates around this issue. And we believe that no one agency or profession or person can tackle this issue alone. It's a complex issue, and it's one that many times in the disability field we sort of tiptoe around because we don't know the answers. But we feel at the ARC that it's time to address it on a comprehensive global basis, and that is what we hope to do through this center. So many of you on the call today may be new to the ARC, and we're hoping that that's true. We want to give you a little overview of who we are and what we've been doing around the area of criminal justice. So we are the nation's leading and largest community-based organization, serving more than 1.4 million people with intellectual and developmental disabilities. We have our headquarters in Washington, and we have a very strong federal level public policy advocacy program, as well as our services, program and services department. Right now we have over $10 million in awarded funds. That's both through the private sector as well as the federal sector. And we provide birth to grave services and advocacy in areas such as prevention, early intervention, and special education, healthcare, employment, and criminal justice. So I'm still surprised when I'm out and about and when I travel throughout the country that people are not always familiar with the ARC, given that we actually do provide quite a bit of broad range of services. Some of our chapters are more advocacy-based, and some actually provide the direct services. But what's exciting is that the ARC is involved in criminal justice advocacy. And we want to hear from you on this issue. We want to engage you as an audience, and we want to know what percentage of people or what percentage of chapters of the ARC provide some form of criminal justice-related advocacy or services. So Catherine just put the poll up for you there on your screen. So if you can take a few seconds, and you may not know the ARC at all, but we would love to hear from you. If you want to take a guess, that would be great. We'll give you a few seconds to answer that. All right, thank you for answering the poll for us. And I did want to highlight, too, that we have a number of chapters that have been providing criminal justice advocacy services for a number of years. One of those is the ARC of New Jersey's Criminal Justice Advocacy Program. They provide justice services statewide, and they have also been able to develop what's called individualized justice plans so that they can provide alternatives to sentencing for people with intellectual and developmental disabilities in the criminal justice system. There's also the ARC of the Capital Area Juvenile Justice Program that provides specifically for juveniles in the system, and they've been able to show a lower recidivism rate for those that they serve. And there's also the ARC of the South Norfolk program in Massachusetts. This is a really interesting program because what they are doing is using they're in the fire department, they're choosing those in the fire department who have specific ties to people with autism. So it may be a parent, a friend, someone who has personal experience because of their family situation with autism, and then training those people to provide training to the fire department throughout their state. And they're finding great success with this type of a program. So I want to move on to giving you a little bit of history about how the ARC got involved in criminal justice issues. And it started a long time ago. One of our moms, who was also turned out to be an attorney, she worked with the ARC of Florida, and she really planted the seed for law enforcement to be trained in the area of intellectual and developmental disabilities back in the 1970s. Because of her work early on, we were able to then take that material and work with the International Association of Chiefs of Police to develop what was then a 4-page training key. And this was later developed into a full-blown curriculum in 1998, complete with video that we used with our chapter network to reach out to local law enforcement. And you'll be able to see this history visually on our website once it launches in a couple of weeks. And we have a nice sort of timeline that you can go to take a closer look at that. So about the National Center, we received a Bureau of Justice Assistance grant through the Department of Justice for $400,000. This is a 2-year project, and what's really exciting is it's the first national effort of its kind to bring together both the victim side and the offender suspect side of issues under one roof. Before, when we had gotten national level grants, it was either focused on one or the other. So for us, this really brings both of those worlds together. We are serving as a national clearinghouse for information on this topic. And our mission is really to pursue and promote safety, fairness, and criminal justice for people with disabilities, whether they're suspects, offenders, or victims. And we want to become that national focal point for resources on the topic and serve as a bridge between the worlds of criminal justice and disability issues. And how we want to do that, the way that we want to do that primarily is by building the capacity of the criminal justice system to respond to these gaps. We know that at this point, while there are pockets of really amazing work going on throughout the country, there still is no way to see these all at one time to be able to measure what is effective and what's not. And we want to provide a solution to that and be part of that solution. We also know that there is no way that as a single national organization that we can accomplish this by ourselves. And we are so excited that we have a number of partners who have excitedly joined this mission with us. You can see here all of the different organizations that we are working with. We felt it was really important to include a number of different disability organizations because this issue affects people of varying conditions that have different diagnoses. And so we brought in Autism Society as well as fetal alcohol, NOFAS, which is the National Organization on Fetal Alcohol Syndrome. And we also felt it was important, of course, to bring in the law enforcement end of things. So we have National Sheriff's Association, the also Police Executive Research Forum, many of whom we've worked with before on different issues in the past. We also have the American Bar Association, and this will be really important as we start to try to identify the different resources through expert witnesses, attorneys who can really start to address this issue and work with local disability advocates around cases like these. We also have a number of advisors, too, that we're excited to welcome to this mission. And we felt it was important to really include advisors that have a personal experience with this issue and who are parents themselves or who have been focusing on an issue that the center really wants to address, which is juvenile justice, sexual victimization, and then, of course, we definitely want to have people with disabilities themselves who can provide their insight along the way. So I just wanted to go over the core of what the center will be offering in the next couple of years. We will be providing training and technical assistance, both website and on-site. We feel like building public awareness is a key of what we are doing through the center, and we will look at specific issues on specific marketing to build awareness around. We are offering white papers and fact sheets as well, and we want to look at what are the model programs that are currently being used throughout the country to provide evaluation around those and then support the replication of those programs. And a big part of what we'll be doing is providing a very user-friendly, interactive, engaging website that has an online resource library with it. And you can see here some of the things that we'll be providing. So for those of you who are more visual learners like myself, I thought it would be nice to provide you with an overview of the center through this sort of mind map. And what I did want to point out here is that right here, and sorry that I can't do a better circle, are some of the models that we've been looking at when trying to think about what are the best ways to provide training and how to not only create curricula or other different materials around this issue, but how can we sustain that effort over the long term? Many times when we've seen different efforts like these happen, it's very time limited because it's due to a grant, which is usually 1 to 2 to 3 years long. So we are looking at models that will allow us to take what we are doing within these 2 years and branch that out for a number of years down the road, and hopefully indefinitely. One of the models that we are highlighting here is the multidisciplinary model, which is really highlighted through the Office for Victims of Crime monies, where they have supported different projects around helping crime victims with disabilities. And they have found through this evidence-based approach that by creating a multidisciplinary model, there is a much greater likelihood of having a training effort sustained over time. So the website is a big part of what we feel like will make this project successful, because we all know that this is an online digital world, and we're thankful for that because it's allowing us to have this webinar today, allowing you to see me, and allowing us to connect without having to actually travel. So we want to provide a website that is just as effective in helping you feel engaged in this issue. The goal is to provide a really strong online presence for both criminal justice and disability professionals. One of the things we'll be doing is creating a short promo video that will really be more engaging for people who come to our website for the first time and learn really what this issue is about. We'll also use that video and feature for training issues or for training initiatives as well. We will also provide a database of resources that's accessible by an interactive map. And we're very excited about creating this because it just makes it that much easier for those of you who are either on the criminal justice end or in the disability world to go straight to our website, click on your state, and find out if there's an expert witness, if there's training curricula available, and what sorts of resources are specific to your state. We'll include a database of model or relevant state legislation and have an INR form available. And another thing that we feel is important is to include these current stories in the media and what our response is from the National Center's point of view. So what I'd like to do right now is share my screen with you so that you can see what the website will look like, and I'll help you learn how to navigate it. So when the website is up, which it's not up yet, but when it will be up in the next couple of weeks, you will be able to navigate this a little bit easier. So this is our home page of the National Center on Criminal Justice and Disability, and you can see here to your left, well, it's to my left, you can navigate from these main links. So if you want to find out more about specific resources, you would just click on resources. And you can look at general resources here, which lists some of our chapter programs, or you could go to resources by audience and click on explore resources. And you can see here that the resources are provided based on category. So if you're looking for something specific for law enforcement, you would click on that and find programs or curricula, videos, anything related to providing training or programs for law enforcement specifically. You can also request assistance directly from the website by clicking on this and going to a form that will allow you to fill out your information. And we're really excited about providing this because we have not been able to provide this much technical assistance or INR on criminal justice specifically until this grant. So we encourage you to get the word out about this, and the more that we are able to log these in, the more we can show the Department of Justice what a large issue this is, and that more funding will be needed to continue addressing this issue nationally. So please send us your requests, and we'll be happy to answer those. Okay, so back to, I will stop sharing the screen so we can get back to the PowerPoint. So we wanted to announce, we're very excited to announce that we already have scheduled our February webinar, and the webinar will focus on crime victims with disabilities. It's an overview for people and professionals in the criminal justice system. And we're very thankful to Nora Baladarian, who many of you probably have heard of before if you've been in the field of disabilities and victims issues at all. And she is really a forerunner on these issues and has created a number of curricula and other materials around it. And she will be speaking on this topic, really kicking off the whole area of victims issues for that series. So we're hoping that you will take some time to sign up for that at the end of our webinar, and Catherine will tell you more about how to do that in a few minutes. And then as part of our NCCJD's goals, we will be providing monthly webinars over the next 2 years. Now, these webinars will be offered the last Thursday of every month. They will be recorded and archived, and you will be able to download those from our website. And as I mentioned a little bit, we are having a victim series that focuses on the first half of the year, and then at the last half of the year, we will switch our focus to suspect and offender issues. And then we'll wrap it up with our last webinar of the year, looking at accomplishments by the center and where we are headed for the next year. So again, we'd like to hear from you because we want to be able to find out what it is that people would like to learn more about on these webinars. We have some options here on the poll, so if you would like to go ahead and take a few minutes to go ahead and choose one of these options. But please also remember that at the end of this webinar, you will get a chance to provide more information through our survey, and you'll be able to write more specific topics in that. But for now, if you would just take a few minutes and go ahead and choose your selection here. All right, and for those who are interested, you can see the poll results there on your screen. And it looks like we do have quite a bit interested in promising practices, as well as some on sex offenders with disabilities. And that's actually quite a big issue that the center would like to address more of. One of our partners is the National Association on Dual Diagnosis, and they've done quite a bit of work around the issue of sex offenders. And so we are looking at the possibility of working with them and developing perhaps some type of publication around that. Speaking of publications, these are the things that we are focused on providing through the center, and one of those is fact sheets. So the ARC has already had fact sheets around this topic, but what we would like to do is look more closely at those, revise those, and also look at what fact sheets we still need around topics that are most important to people in the field. These are the first 3 that we will be updating in year 1. Well, we're also looking at developing white papers. And one that we know that we want to focus on as far as a topic is looking at promising and model programs. Now, we want to, in one document, look both at suspect and victim issues. Other areas that we're looking at possibly developing white papers on include juvenile justice, children with disabilities, and sex offenders. So getting to the heart of what the National Center is wanting to accomplish, I would like to talk a little bit more about our training program that we are developing. And really these pictures say it all in terms of communication can be a hard thing to get right, even if someone doesn't have a disability. And you can see the picture on the right there. It really speaks more to the issue of how deafness, or some level of it, can cause confusion in communication. But now the picture on the right is more in line with the types of intellectual and developmental disabilities that the National Center is highlighting. While it's very humorous, it points to a reality that criminal justice professionals often don't realize about people with different levels of intellectual disability. They are often more concrete thinkers and unable to process information at the same rate as those without intellectual disability. And this can wreak havoc when it comes to trying to communicate. And it also points to some of the challenges that we are seeing that people with intellectual and developmental disabilities face in the criminal justice system. And these just provide some examples of what that could be. As suspects or offenders, they often don't want their disability to be recognized. So we see a lot of problems around people that have more of what we call the hidden disabilities, where there may be a milder form of intellectual disability, and the person doesn't want to be known as having that because they feel like they may be seen as less than or less valued. And so they'll try to hide their disability, but really that doesn't serve them in the long run when they get involved with the criminal justice system. They may not understand their rights, but then pretend to understand, and that can be very problematic when it comes to being read your Miranda rights. They may say what others, they may just say what they think others want to hear, and this really goes to the issue of wanting to be accepted. Often the last to leave the scene of the crime, but the first to get caught. And I've seen this specifically in a case I worked on in Texas regarding a death penalty case. And this is not uncommon at all from advocates who've been in the field and seen this happen over and over again. They have very little options for alternative sentencing and or treatment too once they are in the system. And on the flip side, as victims, we do know that they are easily victimized and actually targeted for victimization because of their disability. They're less likely to be able to report this victimization, again, easily influenced by others. They actually think that the person that is victimizing them or taking advantage of them in some way is their friend. And this is true in a case where we've been assisting with regarding an ATF story that I'll talk about in a few minutes. They're also not considered as a credible witness. So even if they do speak out about victimization in their lives, they have less likely opportunity to be heard in a court of law. So this is why we feel that good training materials that have core competent areas, that core components are so important to our program. We have to think about how we can begin to measure the effectiveness of these different training initiatives. So we will be creating a training certificate program to create this sort of standardized training that communities and states can use so they can feel confident when criminal justice and disability issues arise. We're working at the grassroots level and closely with our state, our local partners and chapters, not just to recreate what has already been done, but we want to fill in the gaps as needed. And we're looking at how this training fits in with other complementary pre-existing training, such as CIT training or crisis intervention training, which mostly focuses on the issue of mental illness. But we want to see how can we marry these issues and be able to provide training to police and other first responders as well as the legal system in a way that fits in with their profession, with the amount of time they have to learn these things as well. We will be going on site to 5 chapters of the ARC, and we will be asking each of these chapters to create multidisciplinary teams, and through that they will be able to create a network of professionals who have a solid amount of training around these issues. And we'll also be able to measure the effectiveness of that training. And as I mentioned before, it's very important that we use these evidence-based models, because then we can measure the effectiveness and add to the field the knowledge of what works based on actual research of how we are providing this training. But we want to hear from you again because we're really interested in knowing how likely is it that if you're able to, say, market this training to your local law enforcement or to your attorney associations, how much more likely will your professional group desire to receive training if it is provided by certified trainers in the area of criminal justice and disability? So if you could take a few minutes to answer that, that would be great. All right, and you can see your poll results there to the right. Thank you, Catherine, for doing the polling for us. And just to give you an overview of what the center will be doing and what we have done, our activities to date, we have been very busy answering a number of INR requests and TA requests. We've also attended a conference that was statewide in Colorado for one of our chapters and provided the Maryland Statewide Commission technical assistance. And I'll talk about that and the death penalty cases here in a minute. We've also been able to complete the first phase of our website, which is currently being reviewed by the Department of Justice right now. And hard at work developing our webinar series to make sure that we are offering topics that are relevant to law enforcement and legal professionals and victim advocates. And we have February meetings scheduled both with the Department of State as well as the International Associations of Chiefs of Police, who we're hoping we can bring in as a partner and start working more closely with them so that we can get training out through that avenue as well. We have been really focusing on responding to reporters when we've gotten different questions because of different stories in the media. And one in particular that is quite interesting is the story that came out of Milwaukee regarding ATF agents. It was alleged that ATF agents were using people with intellectual and developmental disabilities in sting operations. So once we had heard more about what was going on, we discovered that it wasn't only in that state, but in other states where this type of situation was occurring. And so because of that, we were able to meet with ATF. We also wrote a letter to the U.S. Attorney General asking that they end these tactics and that this situation be thoroughly investigated. Because of this, we were able to get another meeting with ATF, which we will be doing in the next couple of weeks, talking to them about ways to provide basic training around disability issues, but more specifically looking at how the training needs to be altered because of their specific population. With the ATF, they tend to focus more on very highly violent situations. So we'll look at how we can take existing training and make it more specific for their needs. Another situation that we've been able to help with of recent is regarding the state of Maryland, who responded to the tragic death of Robert Ethan Saylor by forming a commission to address the need for statewide law enforcement training. And some of you may have heard of this story in the news, but it was truly a tragic situation where Ethan, who had Down syndrome, died in police custody after a dispute over an unpaid movie ticket. And Ethan was 26, and he was killed during a scuffle when 3 off-duty sheriff's deputies in Frederick, Maryland had tried to detain him. So this was a very sad situation, and it brought out some really good advocacy, though, around the topic. And the statewide commission had contacted our national center to provide technical assistance for their internal subcommittee, looking at how to provide some quality training around this issue for their officers statewide. The ARC has also been working with our state chapter there in Maryland to issue a press release around this, and we'll be participating in listening sessions that are hosted by that commission. The ARC has also been involved with a U.S. Supreme Court case, Hall versus Florida. And why this case is so important is because it applies the definition of mental retardation or intellectual disabilities. And this case centers around the death of a 21-year-old pregnant woman. Her name was Carol Hurst, who was abducted after leaving a grocery store in 1978. Now, within the case, Hall's disability was documented through expert evaluations. And really, this centers on if states can establish hardline ceiling on the IQ. Hall's IQ is measured at 70, so it's these kinds of cases where the IQ is very close to being right at the cutoff, which is 70 in most states, for defining if someone has an intellectual disability. And what the ARC wants to do, and through the joining of the amicus curiae brief, we are advocating that states should not be allowed to create these very strict definitions of ID, but look at the professionally accepted clinical definition, which includes looking at people's adaptive behaviors along with their IQ as well. So those are just some of the examples of recent ways that the center has been involved in advocacy efforts. But looking ahead to our next steps, we will be launching our website in early to mid-February, and we will make sure that you get an announcement of that as soon as that is able to happen. We are conducting 3 different focus groups with our target populations, and we'll post reviewed fact sheets on criminal justice and disability to our website as well. And we're very excited to begin building our database of model legislation. So we're hoping that we can hear from our national partners as well as you out there. If you have any information around legislation, if you could send it our way, we would be happy to put that in our database for all of our usage. And we're hoping that you will also spread the word about upcoming February and March webinars. As soon as we get information on that, we will be providing you with that as well. And just so you'll be aware of some things that we are doing in the future as far as trainings and presentations, we'll be going to Chico, California in April. We're very excited to be partnering with National Sheriff's Association, who will be having their national convention in June. And then we're also going to the National Center for Victims of Crime, and there we'll be talking about model legislation. And then the Arts National Convention in October, which is in New Orleans. So we hope to see some of you there. So we want you to get connected with the center and to stay involved. You can sign up here at this email address to receive email alerts about what we're doing. Please use the INR and Technical Assistance Service and refer others to it as well. You can learn about our latest products and services and stay up to date about policy and legislative developments in the area of criminal justice and disability. And we also hope that you will share your story with us so that we can raise awareness around these issues. Since we've started this project, we have had people talk to us more about specific stories where their child or someone that they know and care about has been involved in the system. And what we'd like to do is start a storyboard for our website so that we can share these stories with others and showing how deep these problems go, and start discussing amongst ourselves how to find solutions to these problems. It really doesn't get to the level of attention that it needs without stories like Ethan's and like James Netter's. Until we start sharing those more openly and have a method, a way to do that, it's not likely that we're able to get the kind of attention to this issue that is so needed. So we encourage you to send in those stories and let us know what's going on in your state. So I'd like to end with a quote from Stephen Hawking. I felt like this was a great sort of wrap-up for why we've got to do a better job at communicating between the world of criminal justice and disability. He states the greatest enemy of knowledge is not ignorance, it's the illusion of knowledge. So while we think we may know quite a bit about someone or quite a bit about a disability, it's not necessarily true, and it's important to really look past what we think we know and get to the root of what perhaps we don't know yet. So there's really two major issues facing people with intellectual and developmental disabilities in the criminal justice system. And we've touched on both of those, but I just want to reiterate those. First of all is misidentification, the disability not being identified at all. That's one of the first issues. And then secondly, the whole area of miscommunication. We can presume to know based on our own experiences. And being able to accept that illusion of knowledge, that it may be faulty, is the first step of gaining true knowledge. So I really encourage those of you on the webinar today, and this applies to whether you're in law enforcement, whether you're in the disability advocacy world, whether you have a disability yourself, that we all need to take a step back and really test what we know, and really look at maybe thinking that what we don't know is something that we've got to look more closely at. And that is why training is so important. So with that, I would like to hand it over to Catherine, who will open this up for questions. Catherine?
So first of all, thank you, Leanne, for a great presentation. Here in a minute, I'm going to start calling on people who have questions or reading them from the chat box. So if you guys can see on the bottom of the participant page, there's a little hand that you can raise if you have a question. If your question is not answered during this webinar, or if you have additional questions, you can send them to that info email address there, and we'll get back to you as soon as we can. Also, after the webinar, like I said before, we have a short survey for you to fill out and a link to register for February. You'll have to copy and paste those into your browser from the PowerPoint because we couldn't figure out how to get the links to work. So who has questions for us? Actually, I'm going to start you with one from Pamela Washington in the chat box earlier. And she was asking how we plan to incentivize law enforcement to participate in our training, and how we're going to address the differences in different districts and things like that.
Oh, that's a great question. Well, the incentives is something we've been thinking about a long time, even before we got the money for this project. And one of the things we want to do is look at creating that certification program from within our chapter network. And we're hoping that perhaps by certifying that, it would provide more of an interest around this topic and really validate that this knowledge is important. So that's one of the ways we're wanting to do that. We also think that by using more of a grassroots level approach to this issue, we'll have more success in building those teams throughout the different communities. It's really about building relationships in your communities, and we've seen this through the work that the Office for Victims of Crime has done in trying to help crime victims with disabilities. So we want to build up in these different communities these strong multidisciplinary teams of people who may have a direct relationship to people with disabilities. so that there's really this more internal desire to provide training and to get the message out about why it's so important to have greater awareness around it. So I think that may have answered the question for now. And if I don't answer it all, then please follow up with us and we will certainly get back with you.
All right, we've got one more question here from Patty Saylor. She wants to know, what are your plans to involve self-advocates in the development and implementation of training curriculum and with NCCJD itself?
Oh, great question, Patty. Thank you. We feel that having self-advocates involved is a priority for sure. And we already do have a person with a disability, as I mentioned earlier, James Metters, who is one of our advisors to the project. We are also working with the Self-Advocates National Group, which is SAVE, Self-Advocates Becoming Empowered, and wanting to get their feedback on anything we create. So we want to make sure that it's inclusive of people with disabilities. Also, within the multidisciplinary team, we want to include people with disabilities as co-trainers. And this is based on a model that James and I have been doing with our training around children with disabilities. In fact, James and I have a training that was listed on an earlier slide coming up in California, where we basically together provide that training equal amount of time so that people can actually get a sense of, you know, that people with disabilities are able to provide training. They're able to do many things that perhaps they've never seen a person with a disability in that role before. So we're very excited to provide or to include people with disabilities at every level possible. So thanks, Patty, for that question.
And I'm also seeing some really great comments in the chat box. People working in aging and disability, hoping for some services, and talking about separating the IDD population in prison from the regular population. So, Leanne, if you have any comments on any of that.
Oh, yes. Well, I do for the second issue, which is in prison, and this is why building, I think, a national center is so important, because once you really start looking at this issue, it's huge. We could take a whole, we could do a whole white paper just on what's going on inside the prison or inside the jails in terms of how people are separated out or not. And even when people with, say, an intellectual disability is separated out from the general population, is that really effectively making sure that they're safe or not? And then how are they provided services that they need? And we could look at the field of mental illness just to know that this is a big problem within criminal justice issues. So that is an area that we are talking to a few advisors about in terms of possibly doing a white paper more around services within the prison system. We could also look at how many jails or prisons are providing screening. We do know that some jails do this, but it certainly is not the usual way of doing things, where people, once they come into the prison system or into the local jail, people know right away that that person may have some type of disability. And that's where the issue of identification, again, is so important. And we need to work with our jails and our local prisons and jails to really bring that whole area of identification to them as well. Those are great questions, and believe me, we're keeping all of these for future reference.
Absolutely, and we've got one last question today from Diane Coleman, and she asks, NDRN points out that people with disabilities are being wrongfully killed by surrogates who deny antibiotics or other life-saving measures. Will the center address this type of harm that should be considered criminal?
That's a very good question, and that's actually not one that we have looked at. We are looking more specifically at our target audiences, which include law enforcement, victim advocates, and also disability advocates around issues of getting involved in the criminal justice system as a victim of, say, like sexual abuse or as an offender. So that one may be a little bit out of our scope for this grant, but we are definitely wanting to, even though if something is out of the scope of this grant, we want to start compiling these different issues and looking at how the center can address them in the future. So please also submit that to us.
All right. Now I do have a few more questions that I see in the chat box and in some other places. And if we didn't get to your question today, we'll be working on sending out email responses. And if you didn't get a chance to put it in the chat box or to ask your question, you can also email us at the info address and we will respond. And you can also fill out the survey. So this concludes our program for today. Thank you, Leanne, and thank you to all of you for participating. And most importantly, thank you for your commitment in promoting and protecting the human rights of people with intellectual and developmental disabilities. And we hope to see you all in February. So goodbye. Have a good afternoon. Thank you.